Hey, Dominic, thanks for joining me. Do you want to start by just introducing yourself?
Yeah, sure. So my name is Dominic Lorenzi. I'm the president of Columbia Healthcare Ventures at Columbia Mailman School of Public Health out of New York, and I'm in my second year right now, so kind of wrapping everything up.
Cool. And how did you first learn about Columbia Healthcare Ventures on campus?
Yeah, so when I first came to campus last year, I was looking at all the different student organizations on the campus, and there was like a club fair of sorts, and the Columbia Healthcare Ventures was there. So I was able to get plugged in. I served as the events chair last year, helping put together all the different events that we were hosting. And then this year, I was named the president of the club. So been really fortunate to be a part of it.
Sweet. And what's like the history behind this organization? Like how long it's been around? How many members are in this organization? What are maybe some important details for the audience to know before we dive into the questions?
Yeah, so Columbia Healthcare Ventures, it's a relatively new organization to campus. It was started post-COVID, and since then it's grown tremendously. I think we've been around 3 years now, and it was originally brought out post-COVID, just given the fact that there was more of an importance for the first time ever after that for public health and for innovation within the space. So it was brought about because of that, and it's situated directly within the health and policy management department of the school. So through that, we've been able to have ample resources to market to students. I think we have about 150, I want to say, students within the club, and that's spread across different schools as well, but mostly within our school. And so, yeah, we've really grown since then, and we continue to keep expanding.
Nice. And who joins this org? Like, what are their intentions? Like, do they want to start a healthcare startup? Do they want to join something? Yeah, what's the makeup of the group?
Yeah, so it's the breakdown of the group. It's mostly students situated within the Mailman School of Public Health, and that includes public health students as well as some of the different students within the healthcare space. And there is a lot of different types of students within the organization. We have a lot of students who are founders themselves, who already have a startup that they launched and it was successful. There's a lot of students within the club that are currently working towards building their startup. They could be at the idea stage or entering into one of the funding rounds. And then we have a lot of students just interested in innovation and wanting to know how to make a change for public health and healthcare in general.
Awesome. And how does one get involved in this club? Is there some sort of application process? Is it open to everyone? Can you talk about that?
Yeah, so our club itself, we host a lot of student events, different speakers, fireside chats, and roundtables. Those are open to pretty much any student. The majority of the students that come have signed up for our club and have access to all of our marketing networks. We're really open to any students to get plugged into the actual board of the club and to oversee some of the initiatives and different events we're doing. There is an application process that just includes filling out like a Google form and doing some interviews for that.
Cool. And then can you give an overview of like what the club does? You mentioned fireside chats, roundtables. I saw on your LinkedIn you posted about this like investment thing that you guys did. Yeah, can you give an overview of that?
Yeah, sure. So traditionally, our club has hosted mostly different speaker events, like I had said. We have normally hosted, we'll have like founders or investors or innovative specialists within healthcare come and just talk about the changing environment of healthcare. And then we've hosted a pitch competition, I believe, for the past, I don't know how long it's been around, but it's been around for a little bit. It's a fast pitch competition that we host. There's a $5,000 prize given out. And that one, we just have varying students. Some students have a fully launched startup and they'll come trying to earn a little bit extra money. Some students are just starting out and do that. This past year was the first year we ever hosted the health investment simulation. So that was a great event. We had students going essentially through a case where they acted as private equity investors evaluating a healthcare company. And we had about 7 teams of like 1 to 5 people. There was a $500 prize for that. And we did that in collaboration with HC9 Ventures. So that was a lot of fun putting on. And that will be an annual event that we're hosting again next year as well.
Cool. And are you also planning on hosting the pitch competition again, or what are some of the upcoming things that you're planning right now?
Yeah, so both the pitch competition and the health investment simulation, they both occur in the fall. And so that they will be occurring again next fall. I know we're going to get started doing the health investment simulation, start planning that next semester. And the pitch competition happens every year. So there's a good process already in place for that. And those are our two big events that we host. Outside of that, for next semester, we're also planning on hosting like a Shark Tank style event where we're going to have a product and students have 30 minutes, 40 minutes to learn how to pitch that product to a board of judges. And for that one, we're hoping to collaborate with some of the different schools. We're also doing a bunch of networking events with different schools, such as the engineering school and the business school at Columbia. We're going to have our first event is happening in February, and we're going to do a healthcare industry fireside chat where we're going to have different players such as consultants, hospital administrators, founders, investors, just talking about what they see in the space in terms of innovation and where they see the space going. And so, yeah, those are the events we're hosting. And outside of that, we're also doing a podcast we're going to launch next semester. And that podcast is really going to focus on different graduates that have gone on to found some public health companies. There's a lot of big startups that exit from Columbia, and a lot of these alumni that are coming into the public health school getting an MPH or an MHA, they leave and launch their startup, but there's not as much talk about them. And so that's something we really want to bring that back to the Columbia community as a resource for students.
Yeah, I think that's an awesome resource just to kind of see people maybe a little bit ahead of you doing what you want to do. So I think that's really cool. And then kind of curious, like, what do you see as like the biggest opportunities to improve Columbia healthcare ventures?
Yeah, so I know, like I said, traditionally it's solely focused on events. And that was the main resource given out to students was we have all these events, but a lot of students didn't know where to go from there. So we've really had three things that we've been focusing on this year and that we plan to continue to scale out. The first being we want to create a collaborative space where it's not just our school working on building the entrepreneurship path for public health students. We also want to work with the medical school, the engineering school, the business school, and the undergrad school to foster more knowledge sharing, I guess, between the students, and also bring together different viewpoints on innovation so that we can change healthcare more effectively. Another thing we really are focusing on is starting different traditions within our community to continue to grow our reach, such as the investment simulation. We're trying to do the increased awareness about our pitch competition, as well as the podcast as well. And I guess we're trying to really focus on increasing our resources that are available not just to students and faculty at the campus, but also alumni and alumni startups. We want to make sure that we are able to help them if it's developing and marketing materials for them. We want to host more educational events for the students to really grow, I guess, different knowledge and skill sets, as well as just bring greater awareness to the healthcare entrepreneurship space at Columbia and New York City.
Cool. And for people who are not in school anymore but want to help this community, what are like the best ways to plug in? I know you guys have worked with people who have maybe been judges for some of your competitions. Is there some sort of like mentorship aspect? Is it just come in and speak, or how do they plug in?
Yeah, so we're currently trying to build out right now a mentorship program with some alumni. We're in the very early stages of that, but we hope to have that started by next semester so that if you're a student with a startup and you just want someone to talk to try to figure out how to navigate your path building that company out, we want to be able to pair you up with a mentor for that, someone who graduated and is now a founder of their own company. And then we also want to be able to provide resources. We have a lot of resources within our community. We partner with the Startup Lab in Columbia. So if students need to get plugged into that, we're able to connect them with that. We also have a lot of accelerators and different funds that we talk to a lot, and we know we have resources there. So if students do want to get plugged into one of those type of things, then we're able to connect them. And also just within the whole Columbia community, if you have a startup that might be more engineering focused or medical focused, we're able to connect you with the right people to grow that.
Awesome. And then last question, is there anything I didn't ask about that you think is important for a student to know who's considering this org?
I would definitely highlight that this is I think public health is more important than ever since COVID. And CHV is really trying to foster that entrepreneurship and innovation space, and healthcare has changed drastically over the past few years. And I think it's going to continue to change. So if you are interested in innovation or getting plugged into that, please reach out to us or join our organization. We'd love to have you.
Awesome. Great way to finish. Thank you so much, Dominic, for joining me today.
Awesome. Yeah. Thank you.